Hello, everyone. I'm Dr. Lourdes Sharing. I'm the co-chair of World Sleep Day. And this year, I am very happy to join you to talk about why is sleep so important to prevent cardiovascular disease and metabolic symptoms. So thank you so much for this invitation. It is an honor for me to be with you tonight. So let's start by talking a little bit about what is sleep. Usually, we tend to think that when we go to sleep, our whole body is just sleeping and at rest, and our brain goes into a different stage in which we are completely resting. But that is not completely true. Sleep is a dynamic and active state in which the brain is busy doing other activities. For example, the brain is clearing waste products, is consolidating our memories. Some areas are producing like hormones, for example, in certain pituitary axis, like we're going to see. And our body is also doing other things, like, for example, our heart, our hormones. There's a balance. So sleep is very important, is a state in which we are still active. Our body is producing physiologic activities, but in a different scenario and in a different way than while we're doing awake. So it is very important to know it is not like we are in a coma. Some people say, well, why do I sleep now? I am going to sleep when I'm dead. It is not like dead, and it is not like in a coma. Our brain is still active, and our brain is doing all of these activities that are very important for our functioning. Restoring, it is, our memories are getting stored better, as I said. We do not turn off completely our brain during sleep. And something really important to remember is, for example, when we are sleeping, why do we wake up when we hear a noise? Because our brain, our ear, our hearing system, it's still alert. If we're sleeping and somebody touches us, we wake up. Why? Because our sensory neurons are still active. So when we sleep, we still can feel, we can hear, and in some places there's been research about when we sprinkle water and how that sensory is transmitted to our brain, and it can be produced maybe into our dreams. Like some people dream that it's raining. So those networks are still working in our brain. Also, it is important that sleep is not a whole one kind of scenario for our brain. It is different areas and different brain regions are active or more asleep or more passive or more active in different parts of our brain. As I mentioned, certain hormones, particularly growth hormone. Have you ever heard when someone says that a newborn baby fell asleep, and while he was asleep, he grew? Like, oh my gosh, he's growing. And that is true because growth hormone is produced in a sleep stage called N3, slow wave sleep. Also, melatonin is produced late at night in dark conditions to promote sleep. So very, very important to know that sleep is a dynamic state, that things are happening, hormones are being produced, all of it to prepare us during the day to be alert, to remember things, and to function better. Why is sleep so important for our health? Well, there are various functions, and I'm summarizing these functions of sleep in this slide. One of them is it regulates our cardiovascular system. As we're going to talk in another slide, during sleep, we are regulating between the fight or flight response that we usually have in the sense that our sympathetic nervous system slows down, our parasympathetic nervous system is a little bit more active. So all of that is regulated. Our pulse, our heart rate, our breathing also improves our immune function. Studies have shown that people that sleep the right amount of hours can fight infection better and can also have better response to vaccines. It boosts concentration and productivity. It has a lot of good effects in our attention. If you notice, people that do not have a good night's sleep can sometimes miss things that happen, or when they're driving, they miss objects or things, so they can be more prone to accidents. There has been research on working memory and that executive function that gives us the ability to resolve and solve our problems and really put things together. And sleep also is able to help us solve problems. And there are some stories that are quite interesting. For example, people that have woken up from sleep and say that suddenly they understand things better. One scientist, Mendeleev, who wrote the periodic table of elements in chemistry, he is a historical fact that he woke up with the idea of writing the periodic table after sleep. So we tend to think better, to solve problems during some sleep stages. Also, things that we do during the day, we consolidate and enhance during sleep, because during certain sleep stages, these memories that we learn early during the day get into deeper areas of our brain when we sleep. So we do not recommend for students to stay up all night studying, but to actually study and go to sleep for a few hours or the full night, so your brain can really take advantage of those things that we have learned and consolidate our memory better. It improves our social interactions. We're happier, we're better, we can have better communication skills. Contributes to emotional control. During sleep, there are areas of our brain that are really filtering bad experiences that we have. So when we wake up, we can deal with these bad experiences better, with also bad memories. So it regulates our emotions and how do we respond to these emotions. It enhances creativity. So we, like I mentioned, we can have better ideas. We wake up with more ideas. It is also cleans the waste products that we produce during the day. So during the day, we're active, we're thinking, we're doing a lot of things, and in our body and in our brain, a lot of waste products are accumulating that are cleaned during sleep. And there are some research lately that have shown that inability for this system to clean these waste products or not enough sleep could be associated with some neurodegenerative diseases or neurocognitive deficits. It also, in that sense, it helps us stay young and contrast aging, the aging process, which is produced by this accumulation of substances. And very important, helps us maintain a healthy weight, which is part of our talk today about hypertension, obesity, and metabolic syndrome. So sleep has this regulation of hormones that help us keep our weight in control. The National Sleep Foundation has listed recommendations of time to how much time should we sleep. And in this chart, we can see that, for example, for adults, the minimum time is 7 hours. So we have to sleep at least 7 hours for all of those functions that I mentioned to be really working good and effectively. Younger people like adolescents, teenagers need to sleep between 7 and 9 hours. And the younger the people, the younger children, the more hours that they need to sleep. So for example, one trick to remember is a 10-year-old needs about 10 hours of sleep. So in the chart, you can see between 9 and 11 hours, but one mnemonic to remember is about the middle. So 10 years old, 10 hours, and younger, more hours. So school-age children, younger than the teenage years, or preschool children are between 10 and 13 hours. And as we know, babies tend to sleep a lot. So before infants, before 1 year of age, can sleep anywhere from 12 to 15 hours a day. Sleep is not just one group or one chunk that we sleep for 8 hours, but sleep is divided in stages. So we have what we call non-REM sleep that is divided in 3 stages: the light sleep, N1, N2, which is a little bit more stable sleep, and N3, which is our deep sleep where growth hormone is released. We also have REM stage, which is the stage that we dream a lot. is usually later on through the night. So when we wake up at 5 in the morning, that's the time that we tend to remember our dreams. It also consolidates memories, and it's our emotion regulation sleep stage. So we have non-REM and we have REM sleep. Remember, non-REM stage 1, light sleep. So that's the stage where when we wake up, we feel that we haven't even slept. Like those are the stages when somebody just kind of like nudges us and we're like, no, I was awake, but we were in really light sleep in N1. Stage 2, a little bit more consolidated, a little bit harder to wake up. Stage 3, very much harder to wake up. That's the stage where children usually have more of the sleepwalking, all of the parasomnias, the sleep talking, all of those things. And REM sleep, which is our memory and emotion consolidation. We talked about the amount of time that we need to sleep, but also there are other things that are going to help us refresh and help us function well. So we know the amount of time, 7 hours for adults, but we also have to have sleep continuity. What we're seeing here in the slide is what we call a histogram. A histogram is something that as sleep doctors see when we do a sleep study and we put sensors on your brain and we can tell exactly what sleep stage you are at a particular time. So we can see that you're in N1, N2, N3, or in REM sleep, but we also can see if your sleep is continuous. Some sleep apps tend to identify whether or not you have breaks in your sleep, whether or not you wake up through the night, or you have a big period of time in which you are awake. So sleep continuity is very important. If we sleep 7 hours straight, we're going to feel way more refreshed than if we sleep 7 hours, but we woke up every hour. As a pediatric sleep doctor, something that I see very often is parents that tell me my child wakes up through the night every hour and then they have dark circles or they're not refreshed, they're tired. So very, very important that sleep is continuous. So us sleep doctors need to find out what's going on. Could it be something in the environment, or could it be some sleep disorder that is waking the person up and not allowing for a full night of sleep? So the World Sleep Society, which sponsors World Sleep Day, has put together the 3 elements of good sleep quality. And those 3 elements are the amount of sleep, so the quantity, how much we're going to fall asleep, as we mentioned, for adults, 7 hours, the sleep depth. So we have to have a component of slow wave sleep, to have a component of REM sleep. So we have to go into those stages of deep sleep to feel really restored and take advantage of those memory functions of sleep. And sleep continuity. So sleep can't be broken up through the night because then we don't rest good and we don't consolidate our memory. So remember, the 3 elements of sleep quality are going to be the amount of sleep, the depth of sleep, and the continuity of sleep. What happens when we sleep and how do we know what happens? Well, us sleep doctors have a lot of tools up our sleeve to find out what and how you're sleeping. The gold standard test is the polysomnography, or the sleep study, in which we put some sensors in your head, which are called a limited electroencephalogram, so we can actually see in which sleep stage you are. So we can figure out whether or not you're in deep sleep or if you're waking up through the night. We also can see your body movements, your heart rate, and that's how we know whether your sleep is healthy or not. But also, we do neuroimaging. We can do brain imaging, MRI, functional brain MRI studies to know and see how your brain is sleeping and what functions are done in each stage of sleep. And that's how us researchers find out, well, this hormone is higher, or this area of the brain is more active, or there's more glucose when we sleep, or these hormones are out of balance. So there's a lot of work with research going on. And this slide that I'm going to show is actually showing what I told you, the movement of wastes in the brain when we sleep. This is called the glymphatic system, and it's moving. What we see in red is cleaning all of those waste products from the brain when we're sleeping to stay healthy. And when this system fails, then accumulation of waste products occur in the brain, and some bad proteins can accumulate and damage our brain, and that's what happens in neurodegenerative diseases like Alzheimer's, for example. There are also MRI studies on patients with insomnia or other sleep disorders, and we can see, as you can see in this slide, that some areas of the brain are more activated, and we can tell as sleep researchers or sleep doctors whether or not an area of the brain should be activated or not. So when we see these areas that are very active during wakefulness, we know that the person is not really having a good, deep, or restorative sleep. I mentioned that during sleep, there has to be a balance between what we call the sympathetic and the parasympathetic nervous system. And that balance or that equilibrium is very important, because when we have more towards the sympathetic system, we can have high blood pressure. So for example, in conditions, in sleep disorders in which you wake up through the night, or when you don't sleep well through the night, or you have a sleep disorder like obstructive sleep apnea, you can have an increased sympathetic activation, and you can have elevated heart rate, increased blood pressure, and your heart cardiovascular disease risk is higher. Meanwhile, when the parasympathetic nervous system is higher, then you have more relaxation, lower of the blood pressure, lower of the heart rate. And this is how sleep and sleep disorders can contribute to cardiovascular risk by an imbalance in the sympathetic or parasympathetic nervous system. A regular sleep schedule, going to sleep at the same time, waking up at the same time, sleeping through the night, having a healthy routine, can help to integrate all our organs function. Like in this slide, we can see the liver, the lungs, everything is interconnected and can be connected, regulated with those nervous systems that we mentioned, into have a more integrated organ function. Our stomach can send the right signals to the brain that we're full, our intestines, our fat cells, and that's how some of these regulations, when we don't have enough sleep, are altered, and those signals do not get sent. For example, if I don't sleep at night and I'm up until 2 or 3 in the morning, then I may start getting hungry signals again, because during sleep, those hunger signals are down, and then we don't eat. But when we don't sleep, those hunger signals are increased, and then it promotes weight gain, obesity, consumptions of high calorie meals, consumption of high glucose meals, and then it ensures glucose intolerance. It includes promotes obesity. So all of those things are very important to take into consideration. A sleep stage in which we have hyperarousability, so we wake up constantly, or we have insomnia, for example, will disrupt our hormonal axis, like what we call the hypothalamic pituitary axis. It will make changes in our metabolic rate. It will imbalance the sympathetic parasympathetic system, and it will actually, I like this last part, is a functional neuroanatomic changes. I haven't shown it in a slide, but there is plenty of research that shows that lack of sleep can start changing layers in our brain. So our cortex starts becoming thinner. So that is very interesting, because we want to preserve our cognitive function. We want to have those memories. We don't want to have start having these changes in our brain, both in the white matter and in the gray matter. These changes occur when we don't sleep good. So functional neuroanatomic changes in our brain. Something that it is very important when there is not enough sleep. As a summary here, we have blood sugar dysregulation. So remember, I told you we don't sleep enough, we start eating more at night, we get hungry at night. Lipid control, those hormones that regulate our lipids and our sugar, they are out of balance. We are more at higher risk of metabolic syndrome, which means our blood pressure is high, our weight goes high, obesity, high lipids, cardiovascular homeostasis is out of range. So our blood pressure, which should go down when we sleep, remains higher. And the stress in our heart is higher when we don't sleep our hours and we don't sleep enough, or when we have a sleep disorder. So hypertension, hyperlipidemia, high sugar levels, high risk for metabolic syndrome and cardiovascular disease, and obesity with all this combination. So Sleep deprivation, I love this slide because it's a summary. When we do not sleep, when we sleep less than those 7 hours that we mentioned in the earlier slide, when we have sleep deprivation, we have all of these consequences: increased inflammatory response, derange on the autonomic nervous system, accelerated atherosclerosis. Our arteries actually start getting more damaged with accumulation of lipids and substances. Oxidative stress, which places at risk of heart attacks and stroke. Do you know that if you read the research, or if you look in the news or read in the news, heart attacks are most commonly when we first wake up, and people could get strokes in the middle of the night from midnight to 6 in the morning. When we sleep and people have a sleep disorder, or like obstructive sleep apnea, inflammatory response, high blood pressure, and oxidative stress can lead to a heart attack, can lead to brain abnormalities and stroke. What are these two names there called leptin and ghrelin? Those are two hormones that regulate our hunger signals. Remember I mentioned that when we stay up at night, we tend to eat more? Well, that's because these two hormones are not doing what they're supposed to be doing. So leptin is secreted by our by our fat cells. Ghrelin is secreted by our stomach to tell us that we should not be eating anymore. And so therefore, when we are having sleep deprivation, those signals are not sent to our brain, and we eat more, we're more hungry through the night, we eat the wrong things. We start eating high sugar, high fat meals, and we get to have obesity. So look at this, sleep deprivation, all the consequences, and not just sleep deprivation because of our life habits, but also sleep deprivation because of some sleep disorder that is disrupting and interrupting our sleep. This is a summary of how all the things that I have mentioned just briefly. When we do not sleep enough, we have decreased glucose tolerance, increased sympathetic activity, abnormal immune cell and endothelial dysfunction, metabolic syndrome, and all of this is going to increase our risk for heart disease, atherosclerosis, hypertension, arrhythmia, and increase all cause of mortality. So keep this slide in your brain, in your heart, about the consequences of sleep deprivation. And these are long-term consequences, so over months and over years of not sleeping enough. And that's why night shift workers, people that stay up all night, or people that have this late shift and you're only sleeping 4 hours a night, your risk of cancer, your risk of heart disease, your risk of mortality increases. So take into consideration all of this risk and think about the importance of sleep. This is a summary also about diabetes and sleep. As we have mentioned, short sleep duration and inadequate sleep. I took this from a journal, a publication on inadequate sleep as a contributor to type 2 diabetes in children and adolescents. So think about it. We think of sleep disorders and sleep consequences like heart disease and diabetes as affecting us adults or older people, but sleep disorders and sleep deprivation affect even from a young age, from children, from adolescents, decreasing this control of sugars, increasing cortisol levels, inhibiting insulin, inhibiting these hormones that control our hunger, and can also contribute to diabetes and obesity in children. This is just a slide showing the contribution to arterial plaque, cardiovascular disease, and blockage of our arteries in our heart. Just imagine our arteries in our heart are tiny, so just getting a little bit more lipids, and this regulation can make us or place us at risk for heart disease or stroke. Again, even in the news, so if you not look at the scientific literature, but you look at the news, just Google sleep, a high risk for obesity. And what is the good news is that if you go back to sleeping your 7 hours at night or more, then you can start losing weight. So lose weight, just an easy way is just by improving the time and the amount that you sleep. This is just a correlation that how short sleepers gain more weight overnight, the hunger signals again, and obesity in direct correlation, but it reverses when we go back to sleep. Similarly, with diabetes, with sugar control, you can contribute to better sugar control just by improving your sleep as well and treating your sleep disorder. Like if you have obstructive apnea, treat your obstructive apnea, and you can improve your insulin control, your weight, and your blood pressure. I do, if you Google my name, I did publish a study in which I checked 24-hour blood pressure monitor in children that were doing a sleep study, and also children that were just diagnosed with sleep apnea, just waiting for the CPAP over 6 months. And we could see how the blood pressure, just by that period of wait, got worse. And in those that started CPAP and used it regularly, blood pressure improved, even at the 6-month follow-up. So just pay attention of these symptoms in children, younger ages, children who snore, children who do not sleep well, to prevent these comorbidities like blood pressure and diabetes. I did not want to ignore the fact that sleep disorders can also affect sleep. So it is not just a matter of sleeping longer and having a good sleep hygiene, but you could be suffering from a sleep disorder. So if you snore, if you're very sleepy during the day, if you have a movement disorder, like if your bed partner tells you that you are constantly kicking, or if you have restless leg syndrome, you have insomnia, if you have a parasomnia, a circadian disorder, those sleep disorders can affect your sleep, can place you at risk of all the things that we have mentioned, like your diabetes, blood pressure, and cardiovascular disease. So talk to your doctor if you believe, or your bed partner believes, that you have a risk for one of these sleep disorders. Talk to your doctor. There's a lot of information in the scientific literature, a lot of information in the website about the risk of cardiovascular disease with insomnia, the risk of cardiovascular disease with other sleep disorders. For example, not just cardiovascular disease, but in this publication that I took from a sleep journal in 2007, you can see that patients with insomnia were at higher risk of heart disease, cancer, hypertension, neurological deficits, respiratory disorders, chronic pain. Having not sleeping enough lowers the threshold for pain and makes our pain worse. Patients with chronic pain, patients with fibromyalgia, you need to ask help to sleep better. Ask help from your doctors to help you sleep better, to control that pain. Gastrointestinal disorders like reflux, for example. Reflux is worse at night, is worse at 10 o'clock, and it can get worse if we don't sleep good or if we wake up frequently through the night. So GI symptoms, diabetes, chronic pain, respiratory problems, all of these are proven scientifically to be worse in patients that do not sleep enough amount of time. Now, this is about insomnia, but also patients with obstructive sleep apnea. 83% have drug-resistant hypertension. So if you have a parent, a grandparent, a spouse who needs 2 to 3 drugs to control their blood pressure, ask their doctor to screen for obstructive sleep apnea, because drug-resistant hypertension is known to be a risk in patients with obstructive sleep apnea. You can't control your blood pressure. Maybe it's because you have a sleep disorder. You also, patients with heart failure, patients with cardiac arrhythmias, atrial fibrillation, you can't get the cardiac arrhythmia in control. Screen for a sleep disorder, because if you do have a sleep disorder, obstructive sleep apnea, it is way harder to control your heart arrhythmia and your blood pressure. What can we do to get a better sleep? After all of this bad news that I have shared about how lack of sleep or sleep disorders can have all of these devastating consequences, like affect your brain, your heart, your mood, your memory. How can we sleep better? What can we do? So the World Sleep Society has published the 10 tips for better sleep. So these are 10 things that you can do to sleep better, and I'm going to go over each of those. Establish a regular bedtime and wake up time. That is key. We are creatures of habit. If we go to bed one day at 5 o'clock, one day at 1 o'clock, one day at 10 o'clock, our brain never gets programmed to sleep good and healthy. So establish a healthy, regular bedtime and wake up time routine. Allow yourself to take a nap if you're tired. So don't battle it. Take a brief nap, not too long that it can disturb your sleep the next day, but take a brief nap if you are tired or sleepy, and definitely do not drive if you're sleepy. Better take a nap, stop, take a nap before you drive. Adjust to a healthier lifestyle in terms of drinking habits or drinking caffeine or having some other substances that can interfere with your sleep. For example, caffeine can stay, and that's number 2. So 3 and 4, alcohol and caffeine can really affect your sleep. Caffeine can stay in your system for 6 hours. So if your bedtime is 10 o'clock and you drink a cup of coffee or a caffeinated drink at 7 o'clock, you are likely going to have difficulties falling asleep. Same with alcohol. Change your bedtime snack. Choose your snacks wisely, because these are high sugary snacks, very activating snacks, particularly in children. If you give them a snack that is like really highly sugary, that child is going to be very active and not able to fall asleep. Watch your workout routine. Some people exercise a lot, and that's really healthy. And exercise has helped improve sleep in many ways. And the scientific literature proves that exercise improves sleep. But if you exercise too close to the bedtime, that is going to keep you awake, it's going to boost your energy, and you're not going to be able to sleep. Use comfortable bedding. Choose your mattress wisely. Choose a comfortable mattress, comfortable bed sheets. We can talk about this at another time. You have experts that can help you with choose the right mattress, the right bedding. It makes a whole world of difference. The same with your room. Have a cool temperature, ventilated, keep allergens away, stuffed animals away from the bedroom in children, that allergies can make sleep worse, breathing worse at night. Block out all those distracting noises like ringing in your text messages. Block lights, like the lights can actually fool your brain that is daytime. So you can, even if you're looking at your phone, you can fool your brain that is the daytime, and your brain won't produce melatonin that is important to fall asleep. And reserve bed for sleep and sex only. Avoid use for work and for other recreation, because your brain needs to make that connection. That bed is for sleep. If you use your bed to read, to do homework, to do other things, to watch TV, there's not going to be a connection between your brain and associating bedtime to go to sleep. Again, get a bedtime routine, go to bed early, get a comfortable bedroom environment. Talk to your doctor about your sleep problems. Do not wait too long, because the longer that you wait, the more detrimental that it can be for your heart and for your brain. So thank you so much for this invitation. It's been really a pleasure to participate with AIM Life today for this talk. And I'm really looking forward to seeing the talk and all the activities that are going to be done for World Sleep Day 2022. So thank you again, and I hope that you enjoyed the talk.